Good morning. This book is Cancer as a Metabolic Disease in Origin and Management and Prevention by Professor Thomas N. Seyfried. I bought it in the last week of December last year, 2024. It cost me £112. Why did I buy it? Because it is a new theory about the causation of cancer and how we could treat cancer who are diagnosed with cancer, or those patients on treatment, or who are supposed to be or finish the treatment or supposed to be cured and in remission. And it depends on the nutrition and on the metabolism of the cell. But of course, he does not suggest to use only nutrition. No, he suggests to develop metabolic tools, drugs, or method to help the cellular metabolism to prevent cancer and to treat cancer. And why this is very important for me? Because the classical theory of cancer is that the gene inside the nucleus change and mutate and amplify and make the cell cancerous. And the classical medicine, they do the genes of the tumor. And they want to do drugs or medicine for these gene changes. But the problem is, it is true that the genes are changing, but the genes change in so many variable ways, thousands of ways. In the same tumor cells, you would see many changes. For example, in the same tumor, you see the cells are different in their genetic changes or mutation. So this means that this theory of targeting the genetic changes is useless, and it does not show the cause of the cancer. So in this book, he did experiments on animals and now on human to diagnose that cancer and to understand the cause of cancer. The origin of cancer is the microenvironment inside the cell, and mainly due to insufficiency of respiration in the mitochondria. And how the cells, when the mitochondria become dysfunctional or sick, the cells start to produce energy inside the cytoplasm by fermenting glucose and glutamine, which is amino acid from proteins. The point is, this book shows us the way and the common sense about thinking about cancer, because each cancer is different from the other. Even if they diagnose one disease, each case is different from the other case. But the cause and the origin is the same. So we have to focus on cellular metabolism. And now they develop a protocol which is called stress, by lowering the sugar to 55 to 65 milligram per deciliter and increase ketone. And then pulses, meaning by giving drug to reduce glutamine for 2-3 hours only, and put the patient in hyperbaric oxygen, because the cancer cells will produce ROS, which are oxidative substance, and then they will kill themselves like radiation. It is an amazing book, and I bought it because there are many patients with cancer. They ask me about my opinion and what they will do, and they are all over the world, in Middle East, in Germany, Norway, America, everywhere. So I have to educate myself to give an opinion. And there are cases which are successful. There is a case with breast cancer. She chose to do surgery, but now she is in remission and clear of cancer by applying the healthy lifestyle and intermittent fasting and organic food, exercises, sleep, and all the rest of it, which is the metabolism of the cell. Reverse osmosis water, working on her brain not to become nervous or negative, and so on. And there is another case also. So there are many cases they are getting benefit, but not on its own. It is in addition to the classical modern treatment. In one case is surgery, which is very useful. In the other case is chemo. But the chemo, it is in low doses because the cell become vulnerable when she was fasting, and this will reduce the side effects of chemo. So this is for doctors, for oncologists, and for patients who are interested to understand their disease and how they help themselves all their life. It's not a diet, it is for life. So thank you and goodbye.